Hello, I'm Dr. Franck Yata. Thank you for joining us for the fourth episode of our series on erectile dysfunction. Today, we'll continue with normal functioning and then delve into the causes in detail. If this is your first time joining us, I would recommend starting with episode 1. But first, please make the gracious decision to subscribe to our YouTube channel, like this video, and every video you watch to support us. Also, don't forget to follow us on all our social media accounts. That being said, be prepared for the causes of erectile dysfunction. Each time, we'll make an effort to explain the pathophysiology that goes with it. If we don't manage to exhaust them in this episode, we'll continue to the next episode. Let's go. Remember that in the last episode, we just described the erections of the awake person, which are the most common. There are also spontaneous erections, that is to say, those that occur without conscious arousal, whether voluntary or induced by a sensory stimulus. Some schools classify erections during sleep or those in the early morning as spontaneous erections. The important thing to remember here is that any situation or condition that will prevent, or partially, or totally hinder the occurrence of an erection, as we have just described, will, in reality, constitute a cause of erectile dysfunction.
So any element, circumstance, or factor that blocks this mechanism will lead to erectile dysfunction. So, doctor, all that's left is to name them and tell us how.
You've got it all figured out, and we've already said it. These are organohormonal, psychological, drug-related, and mechanical or traumatic causes. 1. Organohormonal causes. These are disorders that generally result in significant obstruction of blood flow to the penis. This is, for example, in the wake of A. Cardiovascular diseases, most commonly arteriosclerosis. In reality, it's any situation that reduces the cross-section of the arteries supplying the penis, whether in situ or upstream. In the case of arteriosclerosis, there are deposits of atheromatous plaques that will narrow or even block the arteries of the penis. This will, of course, result in the penis being unable to receive enough blood to enlarge and become sufficiently hard. The same mechanism is also observed in a man suffering from high blood pressure or heart failure for several years, where the rigidity of the vascular walls or rhythm disorders produce the same effect of reducing the blood supply to the vessels of the penis. The erectile dysfunction associated with this will be sexual impotence. It is also said that high cholesterol levels promote erectile dysfunction because cholesterol is actively involved in the formation of atheromatous plaques. Yes, cholesterol, you heard that right. The kind most often found in the foods we enjoy eating. So guys, pay close attention to your diet. The other major condition involved in the occurrence of erectile dysfunction is diabetes, especially type 2. In fact, diabetic men have a very high risk, and this risk increases with the duration and severity of diabetes. Therefore, managing diabetes through healthy lifestyle habits, medications, and regular medical checkups can go a long way in preventing or delaying the onset of this dysfunction. But how does diabetes affect erectile function? High blood sugar damages the nerves and blood vessels essential for erections, leading to a combination of macroangiopathy, microangiopathy, and neuropathy over the long term, and consequently, impaired erectile function. Sugar damage to the nerves that control erections will make it difficult to achieve and maintain an erection. Sugar will cause the same damage to the blood vessel walls, impairing their ability to expand and hold more blood. This is why people with advanced diabetes often experience soft erections. B. Hormonal causes. Hormonal imbalances, particularly low testosterone levels, can significantly affect erectile function by impacting libido, energy levels, and the ability to achieve and maintain an erection. Low testosterone levels, called hypogonadism, can lead to decreased sexual desire, difficulty getting erections, and other symptoms like fatigue and loss of muscle mass. Besides testosterone, other hormonal imbalances, including chronic kidney disease, can also contribute to erectile dysfunction. Examples include high levels of prolactin, a hormone produced by the pituitary gland, which can reduce testosterone production, or hypothyroidism, underactive thyroid, and hyperthyroidism, overactive thyroid, both of which can also affect sexual function. It can also be an imbalance between estrogen and testosterone, where high estrogen levels can contribute to erectile dysfunction. The good news is that testosterone supplementation or balancing these other hormones can bring erectile function back into normal range, especially if that's the only problem.
So, thank you for the 5-minute episode. Coming soon, we'll be discussing the causes of erectile dysfunction related to your lifestyle choices, including alcohol, tobacco, and more. So don't forget to subscribe, like, and share our series. Thank you, and see you next time.